A leading health advocate, Dr. Aminu Magashi of the African Health Budget Network, AHBN, has called on the Nigerian government to prioritize healthcare in its 2025 budget by ensuring the timely release of 50% of allocated funds. He emphasized that this crucial step would help bridge critical healthcare gaps across the 36 states and the Federal Capital Territory. Speaking at the first quarterly Congress of the Association of Nigerian Health Journalists in Abuja, Dr. Magashi underscored the urgent need for stronger policies. He criticized Nigeria's latest action plan for combating preventable maternal deaths and sexually transmitted disease (STDs), stating that it lacks key components necessary for effective impact. According to him, despite having a national strategy for reproductive, maternal, newborn and child health, weak state-level execution persists and hinders progress. He stresses that the sector-wide approach (SWAP), designed to unify planning, coordination and budgeting, still experience poor implementation capacity as funding gaps significantly reduce its effectiveness. Dr. Magashi urged the government to develop a fully funded investment plan to accelerate maternal health initiatives, highlighting critical issues such as inadequate electricity, poor water supply, and insufficient infection prevention measures, all of which undermine healthcare qualities in facilities nationwide.
The Every Woman, Every Newborn, Everywhere approach, it has 10 thematic areas. The first one is the thematic area of policies and plans, and the expected result, creating an enabling policy environment for maternal and newborn survival and preventing stillbirth. What we need to do is to have a functioning strategy, and also there's a weak capacity to domesticate and implement at the state level. So we have a national strategy for reproductive, maternal, newborn and child health at the national level, but there's a challenge for the state government to domesticate and also crash the maternal death in Nigeria.
He further stressed the need for transparency, calling for accountability in the allocation of the 280 billion naira healthcare provision fund, while recommending quarterly progress reviews across all 36 states and the FCT to ensure that primary healthcare centers receive necessary funding to address equity gaps across the board.
But the largest numerical figure, and within that over 1 trillion naira, about 280 billion naira is for basic healthcare provision fund to ensure primary healthcare is delivered. About over 200 billion naira also is for immunization, for global fund capital funding, and also for so many areas. So there is some money, at least good news, but we need to get them out of the budget so that it can deliver quality of care for Nigerian women and children, elderly, and all of us.
Dr. Magashi is adding to the growing pressure on the government to take decisive action in improving maternal and child health, ensuring that budget allocations translate into real impact at the grassroots level. Vincent Okushin, QTV News, Nigeria.